Let me first introduce myself. I'm Saja, an associate professor at the Faculty of Pharmaceutical Sciences at the IHCI University in Jordan. I want to give a brief in this short presentation about my newly published article in Global Journal on Quality and Safety in Healthcare that was published in Health Policy Analysis and Perspective section, entitled Community Pharmacy Practice During COVID-19 Pandemic, a Perspective from the Middle East, specifically from Jordan. Jordan is located in the Middle East and shares land borders with Saudi Arabia, Syria, Iraq, and occupied Palestine. Although the first case of coronavirus infection was reported on December 31st, 2019 in China, the first confirmed case in Jordan was an imported case that was confirmed on the 2nd of March 2020 for a young man who had visited Italy. WHO has announced coronavirus as pandemic and that SARS-CoV-2 is highly infectious, spreading rapidly via human-to-human transmission, and unfortunately, with no current effective drug therapy or vaccine. If we visited the WHO coronavirus disease dashboard that report confirmed cases of coronavirus on daily basis worldwide, we can see that Jordan still has a reasonable number and a low number of confirmed cases compared to adjacent countries. On September 8th, Jordan has 2,400 confirmed cases, out of which 16 died, compared to Lebanon that has around 20,000 confirmed cases, out of which 191 died. In Saudi Arabia, there are around 320,000 confirmed cases, out of which around 4,000 died. In Iraq, there are 260,000 confirmed cases, out of which around 7,500 died. So coronavirus is highly infectious. It is a public health event that needs worldwide attention and collaboration. Healthcare workers caring for patients are at a particular risk of infection. And there are confirmed cases of death among healthcare workers. The International Pharmaceutical Federation listed the name of our colleagues of pharmacists who lost their lives during this coronavirus pandemic for commemoration. Similar to other affected countries, Jordan has announced several protective measures and restrictions to control the pandemic. On March 15, 2020, the government announced the closure of all nurseries, schools, and universities in the kingdom. Cinemas, swimming pools, and gyms were also closed, and religious services in mosques and churches have also been suspended. On March 17, the government suspended all flights to and from the kingdom, except for air flight. And all the around 6,000 arriving passengers were sent on that day to quarantine in assigned hotels for 14 days at the expense of the government. On March 20, a comprehensive curfew for all public and private sectors was implemented. It lasted for almost 40 days, during which people were allowed to buy their basic goods by walking to nearby stores on restricted hours. Transportation was also prohibited during the comprehensive curfew, with a few exceptions made for vital sectors, including healthcare. So Jordan national public health and regulatory bodies have initiated preparedness and response activities similar to other international bodies in order to provide health services under pressure and protect healthcare providers in the front line. So similar to international professional organizations, we in Jordan have issued recommendations and guidelines to help the healthcare workers worldwide practice their healthcare roles in a safe manner. So in this article, I share Jordan's responses of providing community pharmacy services during the lockdown and measures taken by the Jordanian Pharmacists Association in collaboration with other authorities and policymakers to meet the unique needs of community pharmacy services during this pandemic. In addition, the local guidelines were discussed in light of available international guidelines. So the local guidelines for community pharmacy and pharmacy workforce in Jordan are discussed in two sections. The first one, guidelines to provide community pharmacy services safely during the pandemic for pharmacists, and also guidelines to maintain a stable supply of pharmaceuticals and personal hygiene products and sustain chronic medication supply for patients, as well as milk formulas for infants. In addition, in this article, I discussed these local guidelines in light of other international guidelines, like the guidelines for International Pharmaceutical Federation for Pharmacists, the guidelines for National Health Service in England, guidelines for Centers for Disease Control and Prevention. Mostly, these guidelines share common points, and the differences mainly due to local laws regarding the local laws that govern pharmacy practice in each country. These guidelines are summarized in table in different categories. So there were local guidelines for pharmacy layout, local guidelines for precautionary measure for customers who enter the pharmacy, guidelines for precautionary measures for pharmacists themselves, and there were guidelines for supply management, and there were new services that were implemented in order to protect the supply of important drugs and also to sustain and help chronic disease patients to have their chronic medication supply during the lockdown. In addition, in this article, I discuss unique roles played by community pharmacists in other countries. And these roles should be taken into consideration by health authorities worldwide to help control the spread of this virus. So the role of pharmacists in the COVID-19 pandemic goes beyond the expected role. Community pharmacists in China, for example, played a key role in smooth implementation of the guaranteed mask supply for the residents there to control mask shortage. And also, pharmacists can play a unique role in screening for COVID-19 suspected cases and making appropriate referral to health authorities in order to help the authorities control the infection. Since community pharmacists are considered by PHIB the first point of contact with the healthcare system for those with health-related issues, the national authority bodies can take advantage of this position of the community pharmacist as the first point of contact when the affected people ask for basic medical aid for symptomatic relief, and design a referral scheme that engages pharmacists in the referral of suspected cases. In addition, licensed pharmacists in United States can test for COVID-19, collect, store, and ship the specimens appropriately for the designated laboratories. So the Jordanian Community Pharmacy Standard Operating Procedure Guidelines that are mentioned in this article share common points with other international guidelines, with variation, as I mentioned, related mainly to restrictions by local pharmacy practice laws and with some issues regarding the number of patients per surface area of the pharmacy. In addition, as I presented, that the scope of community pharmacy practice varies across country, and we can benefit from other countries' experiences and survey ways in which community pharmacists can assist the public health authorities in controlling the spread of this infection. If you want to read details about these local guidelines, you can visit the Global Journal on Quality and Safety in Healthcare website and download this article for free. Thank you for listening.